So one of the main things I was looking at from a posture standpoint is that from the front side, I could see your left shoulder is higher than your right. Okay, so that's indicating you're turning towards that side. So this left shoulder is being pulled back. But then if you look at yourself from the rear view, you can see that it looks like the left shoulder is a little bit lower than the right. And that has to do with the fact that you have a little bit of this rib flare to the left. So basically you pull your left shoulder back and then you flare your rib towards the right. And so that pushes you on the outside of that right foot, right? Which is why you have a little bit more tibial external rotation on this right side. And then you almost hike the hip up a little bit just to get on the inside of that foot. Okay, so if I don't have the ability to internally rotate, then I'm going to use something else. Maybe I'm gonna push my hip forward, maybe I'm gonna hike my hip up just to get on the inside of my foot so that I don't fall over, right? And so what we're gonna do is unlock the left upper back a little bit, kind of turn yourself back towards that left side, open up the left while we're improving your right side's ability to internally rotate. The part, okay, I want you to reach your hands forward, all right? And then I just want you to do a couple squats, okay? Good, and turn those toes forward. It's hard to keep them forward, isn't it? So again, usually when those feet turn out, especially that right side, it just means that as you go down, your hips are shifting towards that right side, right? And you're losing space in the front of the hip. Right around that 60-ish degrees of hip flexion, that's kind of when your foot wants to start to turn out towards the side. So that's probably when you start to miss out on that hip flexion and internal rotation, right? So you kind of go like this, and then you turn out as you kind of sink into that. So right around that 60, you can kind of feel that right foot turn out. Perfect, good. Now I'm gonna get you your feet together, and you're just gonna bend over and touch your toes. Okay, perfect, and then come right back up. And do you feel that tension in the SI joint when you bend over like that?
It's more QL area.
More QL on both sides or one side?
Mainly the right side.
Maybe more the right side?
Yeah.
Okay, let's go again. Yeah. Again, as you're going down, it's almost like you're shifting towards that right side. Keep your feet together, arms crossed. I want you to turn your body to the right and then turn it to the left, okay? And I just want you to do it a couple times, and I want you to tell me which side feels tougher to turn towards. Do you feel any type of restriction?
This side.
Going towards the left side?
Yeah, all through here.
Yeah, you feel like more tension to the right?
Yeah.
What about the hips if you do that? The right side going towards the left side, right?
So when I turn this, I feel the restriction here.
Yeah.
And then if I turn here, this feels very open.
Yeah, okay, so go to the end of that turn again. Okay, so when you turn this way, you need this right hip to be able to internally rotate. If you turn towards the mirror, just so you can see it, so turn towards the left, can you see how that right side has to internally rotate just to get into the left? Right, so if you can't internally rotate that right side, it's gonna be hard to turn into that left side. And so even when you wanna turn into the left, if you want to put my hands on you, yep, you wanna do this to get over towards the left side.
Oh, yeah.
Right, so do it again, turn right. Good, and then turn left again. And you can see how you bend more on this side. This left shoulder actually drops down more. Yeah. So that's why it feels a little more restricted, because you're turning towards the left. And if you're doing this, it's no different than this right hip dumping forward, and that's why you feel that tension, right? So I'm just gonna take a look at your right hip flexion and internal rotation, okay? Just tell me if you feel any pinching or any type of restriction when I do this.
Right in it.
At what point do you feel that?
Right there.
Yeah, which this matches up exactly with the squat, right?
Okay.
At that point, that's where you start to kind of turn the foot out, you start to shift, okay? If I bring it up there, does it pinch more?
Yes.
Yeah. If I do that, does it pinch more?
Yes, and it pulls.
It pulls? Where does it pull?
I feel everything pulling right from here
From
down
the pubis
to there.
down?
Yeah.
Okay. What about if I do that way?
Outside.
Outside?
Yeah.
Okay. Yeah, we have about maybe 5 degrees of internal rotation here, right? But even to get there is a little bit of restriction. So let's just keep that in mind right there.
Okay.
Just remember how that feels, and when we do some stuff, just do this for me, just to show a test, okay? Lift your left arm up to the ceiling. Bring it towards me more, okay? And pretend like you're pushing me away, all right? Now, with this right hand, put your right hand in your left rib cage. Pull it down just a little bit. Good. Okay, so reach towards me a bit more. So reach across your body, okay? And really reach. Good, okay. Feel any restriction in that hip?
No.
No? See how much more internal rotation I got?
There's no pain either.
Yeah. So see how much that left rib affects the hip?
I just feel like clunking.
The clunking? More in the shoulder blade or in the shoulder?
Right in the shoulder.
Yeah.
That I feel restriction.
Yeah, where do you feel the restriction? Right around the neck.
Yeah.
Yeah. Okay, so that's perfect. So you can see how much the neck can influence the shoulder, especially the internal rotation. So they say that if you can't internally rotate the shoulder, then you're going to roll the shoulder forward more, and then that's going to pull all this fascia and muscles around that neck, right?
Yeah.
That's better than the right side, but still a little restricted. And you feel that restriction,
Yeah.
right? Yeah. Perfect. Okay. One last thing I'm going to test. Just test the shoulder flexion. Yeah, right around there you start to kind of shrug. I think the arm wants to go towards your head.
Mm-hmm.
Yeah, right around there, right? Yeah.
I feel that all through.
You feel that through there?
Yeah. Like the forearm is screaming. And the pec.
And the pec?
Yeah.
Okay, at what point do you start to feel that?
Forearm right now.
Yeah.
And pec pretty much right there.
Okay, great. So right around 60 degrees, no different than that right hip, right? So you sit on with your left butt, right knee is gonna be down like this, okay? So I don't want your right knee out towards the side. I want it more in front, just so when you're in this position, it's nice and relaxed. I don't feel a lot of muscle tension. If you start to feel a lot of TFL or anything like that in front of the hip, then I may just have to raise this up. So you just let me know. And then I'm gonna get you into this position. So sternum is over that left knee, okay? And essentially what this is gonna do, this is gonna create a little bit of length through this right leg. It's gonna get a little bit of internal rotation, but when I'm turning towards this side, especially when I push back, well, I'm gonna get this left rib to come back a little bit more compared to the right, because when I push, show you from the front, when I push, it's a little bit of this kind of rotation happening, right? I'm not gonna get you to do that, but that's just what's happening in this position, okay? So you're just gonna set up in this position, right inside knee down, left outside knee. The reason why you're sitting on this is to make it so it's easier to get the left outside knee on the ground.
I feel localized pain like right where it's touching the ground.
Yep. Do you feel any muscles around the hip?
Muscles
working?
around the hip working. It just feels like everything's pulling me back.
Everything's pulling
I
you.
can't like fall forward.
Okay, so think about this. Reach your knee towards me as though I'm pulling it out of the socket. Now, in that position, press your knee down. I can already see your glute working.
Yeah.
Do you feel it?
I feel the gluten and I feel pelvic floor right here.
Amazing. So with your arms, pressing through your hands, I want you to think about pushing your chest in between your shoulder blades. Good. So not coming through here, relax for a second, more so coming right through there. Perfect, okay? Want your head looking forward, all right? So you're gonna take a big breath in as you push your chest back. Feel a nice big stretch in between the shoulder blades. Keep this position. As you breathe out, you're gonna press the knee down. Now, if you feel like in between, you feel like that femur wants to go back in the socket, you can just reach it out again. Good, that's perfect. Breathe in, reach back. Tell me if you feel any tension in the hip.
No.
No tension? All right. So you were feeling tension right there before. So now, okay, well, that's better.
Yeah. That I still feel like it's pulling almost like rib cage down to
Yes.
the pubis.
I was forcing it a little bit, but let's just go there. Yeah, okay, so we improved it. We still have some work to do, but we got it from about there to about there, right? And then I hit the hard block, and then that's when everything wants to deviate out. Look how much more internal rotation is there.
There's no clicking.
No clicking. And how about the pulling in the neck?
No.
No, okay, so no more pulling in the neck. So that's amazing. This could be a towel. This could be anything like this. I mean, this is called an ab mat. It works really well, but the purpose of it is I'm gonna get you to lay on top of it, your left ribs, because you wanna do this, So I have to get you more almost closing down that left side as this side opens. I'm gonna get you to lay on your left side. So this is gonna be underneath like your left ribs. So you're gonna lay on top of your left side like this, all right? You're gonna get close enough to the wall where you can have your right foot on the wall, but your knee stays bent. So this would be basically in line with my hips. This is me above my hips, and when I press into the wall, it should feel like you're pressing harder into this pad with your body. That right foot is pushing you into the ground. And then I'm gonna get you to take your right hand and bring it down here more. Okay, but you don't have to twist it so much, there. And I want you to think about you're pushing your ribs back, there, okay? Now if you push into the wall, what muscles do you feel working?
Feet and quad.
Okay. If you turn this hip forward a little bit, now what do you feel?
You're gonna hate me, but feet and quad.
Okay, okay. Let's get a tiny bit closer to the wall.
Okay, now I can feel hamstring and glute.
Perfect. Okay, that's the position I'm looking for, okay? Well, that's the muscles I want you to feel, all right? One of the things I don't want to do is tell you what you should feel, just because then you're going to squeeze your glute or you're going to find your hamstring, right? But remember how hard it was to find that hamstring and glute, right? So now we're able to get it, but it's just finding the position that's best for you, okay? So one thing that you want to do is you want to roll the hip back. So just as a rule of thumb, just roll the hip forward just a little bit, all right? Enough that you can still keep the heel on the ground, okay? So if you roll too much, your heel's going to lift up.
I feel like my peroneals are on fire right now.
They do, yeah?
Yeah.
It's just because I'm getting you to internally rotate a little bit.
Yeah, like the feet muscles are.
Yeah, right around here, right? The outside of the shin?
Yeah, but also like right from big toe up through here.
Yeah.
They're hot.
Okay. Okay, so roll the hip forward a little bit. I want you to push this into the ground and reach the elbow forward. Perfect. Okay, so you're gonna breathe in as you push this right foot into the wall. Tell me what muscles you feel.
Everything in the shin and some hamstring and glute.
Good. As you breathe out, push the right hand. Good. Breathe in, press the right foot into the wall. Think like you're pressing through the wall, you're reaching through the wall. And then breathe out, press your right hand.
A lot more hamstring.
Amazing. Great. Good. Let's reset the pelvis a little bit, tilt it forward. There you go. Breathe out. Awesome. And one more, okay? I know it's hard. Breathe in. And then breathe out. Press. How's that feel in the right hip?
That feels fine.
Feels fine? We got more.
Yeah, I feel it in the hip flexor.
Feel in the hip flexor?
Yeah.
At what point do you feel it?
Right there.
Yeah. We picked up about another 5 degrees,
Great.
but it's not as much as I want. What we want to do now is kind of use a little bit more load to try to open this up. It'll be like left foot on top, and you're going to pull the cable down to your right leg like this. Okay, so it'll be breathe out as you pull, breathe in as you hold. So breathe in.
Am I breathing into the upper back?
Yes, yeah. And honestly, you'll feel that already open up because of the cable. When you do this, when you breathe in, I want you to feel like you're lifting yourself up to the right leg. Let's get close to the box. This right foot right up to the box, okay? This left knee, I want forward. I want you to stand tall, okay? But what I want you to think is push the knee forward. Yeah, so see how your knee went forward and your hips went back?
Yeah.
So I want you to reach the knee, yes. You feel that? Okay? So come out of it for a second. I want you to try to do it yourself. Yes, okay? Then, when you pull down, I want you to pretend like someone is gonna like poke your stomach back. Yes, okay? Take a big breath in right here. Breathe out, pull down to the right leg. Good, hold right there. Take a big breath in, get tall through the right leg. Breathe out, come back up. So inhale through your nose here. Breathe out, pull down. Stay right here. Breathe in, get tall through the hip. There you go, it's perfect. And then breathe out, come back. Now, what do you feel working?
I feel everything on the right arm.
Yeah?
From the wrist to my shoulder.
Yeah?
And I feel from my big toe up to my hip, it feels like it's trying to turn one way.
Trying to turn which way?
The toe is trying to turn in. Everything's trying to turn in.
Everyone trying to turn in?
It feels like it's collapsing in, yeah.
So does it feel like there's a rotation towards the left?
Yes, it's rotating this way.
Good. I want you to rotate that way. Yeah, from the back, it doesn't look like anything's dumping in. It just looks like everything's rotating, which is great.
When I pull down, it feels like I'm going to fall back.
Yes.
Yeah.
That's the whole.
I can't catch myself.
No, because what you want to do is you want to do this to kind of push yourself forward.
Yeah.
Whereas this is pushing you into your hip, right? It's kind of pushing you back into your hip. The reason why I have this left leg on top is because, again, one of the things you also mentioned was that it's like this left leg was longer.
Yeah.
And that makes a lot of sense because if your ribs are flaring, push you to the right, you have all this weight on the right side, so this left leg can pick up. So it's like this is being pushed into the socket, so then you have this hiked hip, and it's shorter, right? So if I pull down towards this right side, get you to breathe in as you lift up, I create that length. I'm almost like, it's not actually happening, but I'm like thinking about pulling the femur out of the socket a bit so I can reduce the tension of all those muscles trying to push it in.
Yeah.
Do you know what I mean?
It's crazy when you were here and you were like, get tall.
Yeah.
And instead of me getting tall like this, you made me get tall like this.
Yes.
I noticed that my posture, when I think I'm standing tall, is not standing tall. It's actually pulling me forward rather than this being tall.
And that's coming from your hip.
Yes.
Yes.
Yeah.
Okay, and go in that position. Okay, without the cable for a second, just think about that height thing where I'm getting you to go tall. Does it feel like it's more in the hip when you do that?
I feel like I can straighten this without this dumping down.
Amazing.
Yeah.
Okay, so that's the adjustment we're gonna make. And I think, let's turn this foot in just a little bit. Bend this knee just to start. Good. Can you try to get tall without this knee extending? Yes. How does that feel?
Tight.
Yeah?
Yeah.
Where does it feel tight?
The entire right side.
Yeah. So I want you to think, like, when you're pushing through your foot, it's not your knee slamming back. It's your knee staying right here and the height's coming from exactly. I want you to, again, same thing. I want you to push that left knee forward a little bit. There, okay? All right. Take a big breath in through your nose. Breathe out, pull down to the right side. Breathe in, get tall through that right side. Perfect. Breathe out, come back. Breathe out all the air. Feel like, yes, that was the position. Exactly. Stay right there. Breathe in. Breathe out, pull back. And when you breathe in, don't let those lower ribs come up. Keep them locked down, okay? There you go. Yeah. How's that feel?
That feels like butter.
Yeah, it feels great?
Yeah.
There you go.
Good.
Does it feel good? Any pinching in the hip? No. There we go. That's great.
Wow.
Okay. I think that one was the best one for sure.
Yeah, I'm going to be religiously doing that exercise.
Look at that. Yeah.